So the virtual learning circles were designed really to bring together leaders in community, policy, and philanthropy to think about what are some of the most pressing issues for social change for early childhood.
So I think that there's a real opportunity to think about, making sure we actually know what we think we might know and what some of our guesses might be, but making sure that we have, really solid research-informed interventions that are coming out to be able to make sure that we're investing in what matters most for families and providers.
Wanting to make sure that we're hitting an urban, a rural, and a suburban area to see if we could launch this new idea of bringing employers, employees, and the state of Michigan together to pay for childcare as a way to make it more affordable and accessible for families, and also as a way for employers to be able to attract and retain employees.
Home-based childcare is the most prevalent form of childcare in this country. It is also the care that we know the least about, that we value the least in both our early childhood conversations and I'd say our society at large, and it is the care that we invest the least in at the public level. And so that's really why homegrown exists, because while, millions of young children are having their early childhood experiences in this setting, very little of our public attention, our research and innovation, and our investment, goes there.
I think in the health sector, the major transformation to become far more supportive to the well-being of families has to be a team-based care model.
It's important to me that whatever we create we could apply to anywhere. So we've been really thoughtful in our approach. And so I would say in terms of our biggest lessons learned on our home visiting side is that home visitors are really held in high regard by their families, and the families see a place for their home visitor to be part of their care team. But that we've learned generally, providers are very unfamiliar with home visiting services.